ESG and ESG-CV. My name is Kimberly Simpson and I am today's moderator. If you are just joining us, please go to the chat box and introduce yourself with your name and the region you represent. As a reminder, this office hours session is being recorded for public record, and a copy of the slide deck and recording will be emailed to all attendees. Next slide, please. How to ask a question. All questions must be submitted in the chat box. Please type your question into the chat box. The team will read questions out loud at the end of the presentation and provide answers if possible throughout the presentation. All questions and answers entered into the chat box will be recorded as part of the public record. Alongside our presenters, we also have several HCD staff, including ESG representatives, ESG-CV grant administrators, and other consultants who are able to answer questions during the Q&A session. Next slide, please. Today's office hours session agenda includes ESG-CV updates, office hour updates, upcoming trainings, ESG and ESG-CV Q&A, and our Spotlight series presentation, PHA and CoC funding collaboration by Erica Snyder. Next slide, please. For your ESG updates, your 2021 standard agreements. If you have been awarded homelessness prevention funding and you have not turned in your updated policies and procedures for HCD to review and approve, please do not forget to do so by December 15th. Reminder, HCD will not reimburse any HP expenses until this process has been completed. Avoid recapture, 20% expenditure milestone deadline, 120 days from execution date. If your contract has been executed and you need help navigating the eCivis system to complete your RFFs or to add additional people from your agency to manage the award, please reach out to esgnofa@hcd.ca.gov and we will provide TA to you. Next slide, please. Avoid receiving STD 209s and reimbursement delays. All 2021 contracts are managed in eCivis. All requests for funds must be submitted through eCivis by clicking the Financial Report tab. Please do not email these requests to your representative. Every request for funds must also include a completed detailed expense report. HCD is conducting mini monitoring for every reimbursement request. This will include anywhere from 3 to 4 line items chosen by your HCD representative and will also include complete client files if requesting reimbursement for rapid rehousing and/or homelessness prevention expenses. Reminder, all supporting documentation must be redacted and submitted through the secure SharePoint site. Please do not upload the documentation in eCivis noted in HCD's PII policy. Be sure to have your supporting documentation ready to submit when requested from your HCD representative. Next slide, please. 2022 applications. The ESG team is currently reviewing the BOS competitive applications. All CoCAE applications have been reviewed. All BOS non-competitive applications have been reviewed. ESG representatives have sent all applications that need corrections back to draft. If you need help or clarification on corrections, please reach out to esgnofa@hcd.ca.gov. Reminder, you cannot add additional people from your organization to view the application award until a contract has been executed. Next slide. This slide includes ESG policy document links, which can be found on the ESG webpage under the Resource tab. Next slide. This slide contains your ESG team representatives. Also, you can also send an email to esgnofa@hcd.ca.gov for any ESG questions. Next slide. Now our ESG-CV updates. Expenditure milestone deadline is January 31st, 2023. All ESG-CV grantees must have expended at least 75% of their total award. Requests for funds, financial reports with actuals must be submitted no later than January 31st, 2023. No accruals. Next slide, please. Reminders for performance milestones. All program funds for projects, street outreach, emergency shelter, rapid rehousing, homelessness prevention shall be expended by September 30th, 2023. All funds for HMIS and administrative costs shall be expended by October 31st, 2023. Call for success stories. HCD is collecting success stories for the ESG-CV grant. If you have a success story from one of your providers or your programs that you would like to share, please email it to your grant administrator. Remember to not use any PII in the submission. Next slide, please. HCD office hours, upcoming office hours, December the 21st and December 28th, there will not be any office hours. January the 4th through January the 25th, there will be an office hours, but there will not be a spotlight series. Our spotlight series will return February 1st, 2023. And someone is going to drop the link for the HCD office hours into the chat. Next slide, please. Upcoming trainings for January the 10th from 1 to 3. There will be a trauma-informed racial equity training. This session helps to unpack the nuances of how trauma impacts the lives and care of our clients, as well as the root causes behind trauma and ultimately how we can deliver, empower, person-centered care without re-traumatizing those we serve. Someone will be dropping the link to register for that in the chat. Next slide. This slide includes some COVID response resource links. Next slide. This slide includes monkeypox resource links. Next slide. And this slide includes ESG resource links. And all of these links will be included in the whenever we email out the slides to you all. Do we have any questions? Okay, I see we do not have any questions so far. Next slide, please. If you would like to if you have any questions, feel free to contact your annual ESG rep, or you can send an email to esgnofa@hcd.ca.gov. And for ESG-CV, please reach out to your grant administrator. Next slide, please. And now I will hand it over to Erica Snyder for today's Spotlight Series presentation on PHA and CoC funding collaboration.
Thanks, Kimberly. Hi, everyone. Erica Snyder joining y'all from Carlsbad, California, down outside San Diego. We talked about PHA and CoC coordination a few months ago. So this is kind of going a little bit deeper to talk about how can you use your resources as rapid rehousing providers, or in some instances, permanent supportive housing providers with public housing authorities. Next slide, please. So I'm not going to read you all of this, don't worry. But as a refresher, the roles of public housing authorities and continuum of care, we serve similar populations, but there are nuances and differences in terms of responsibilities and in the populations that are being served. Public housing authorities have a lot of, they have volumes of guidance that guides what they can and cannot do with their programs. But ultimately, if we're going to distill it down to some very simple ideas, would be that their primary purpose is to provide decent and safe rental housing, and that they often are doing that through housing choice vouchers, which is more than just Section 8, but that is one of those pieces. And those housing choice vouchers are providing that rental assistance. And whereas the continuum of care is a community-wide commitment to end homelessness, there's a lot of different stakeholders at play, and there's that variety of funding sources, from temporary housing interventions like street outreach and emergency shelter to things more permanent like rapid rehousing and permanent supportive housing. And so the folks served by the CoC may also be served by Public Housing Authority, but it's not always a one-to-one match. Next slide, please. So for our housing choice vouchers, just to make sure we're all coming together from the same foundation in terms of definitions, HCVs or housing choice vouchers are designed to serve and provide stable rental assistance to households who are considered low income. And it's typically being plugged into your privately owned housing, so your general housing market. There's a lot of housing authorities across the country that administer it, but on average, we're talking about 5 million people in the United States who are receiving a housing choice voucher. And then the number of households varies because at times it's going to be your families or individuals, but there are a lot of folks who are getting assistance here. On an annual basis, Congress allocates funding, public housing authorities get that for rental assistance. 75% of the new households who are getting that new voucher every year need to meet that definition of extremely low income, which is 30% area median income and below. And that remaining 25% can serve folks up to 80% area median income. And this is going to vary across your housing authorities, the types of vouchers that they have, their admin plan, but this is just our general rule of thumb. And you've heard me mention this covers the rent, and that vouchers are designed to cover rental assistance, but not services. As I'm sure everybody on this call is acutely aware of, yeah, but sometimes people need support after they're housed. And like I mentioned before, Congress approves that number every year based off of voucher utilization, inflation, a variety of things. And so the total rental assistance may go up. That doesn't always, though, correlate to a one-to-one increase in the increase in housing vouchers, because as rents go up, that means it's going to cover, housing authorities are going to have to cover higher rents for a longer period of time, and that could mean a reduction in the number of vouchers that are available, or the same amount. It could be flat. So sometimes folks get confused with that, but it just has to do with, as rents continue to skyrocket, it does adjust how many folks are served and where across the board. And then I just want to call out a few different types of housing choice vouchers that we see, and the ones without services, these may be familiar to folks, such as Section 8. A lot of folks first think about that. There's also another voucher type that is one of our special purpose vouchers called mainstream vouchers. Sometimes it's called 811, and it's designed to serve people with disabilities up to age 62. And that's a variety of disabilities. It can be a little more flexible, and it's often done in partnership with other health providers and a variety of folks. There's also what I'm guessing most people on the call know, which is emergency housing vouchers. And those were designed to serve people who are currently experiencing homelessness, at risk of homelessness, who meet VAWA, who were recently housed through the homeless service system. And while it doesn't come with services, it does have something called a service fee that was really designed to take care of the upfront costs of getting somebody into housing, providing security deposits, incentives, furniture. It could even be a risk mitigation fund, but not dedicated case management. And then there's some new vouchers coming down the pike called housing stability vouchers, and that's going to be designed to serve folks experiencing homelessness or at risk of homelessness. There's also one called non-elderly disabled, or NED, and then tenant protection vouchers. So those are some in that category. And then ones that are often coming in partnership with services would be Veterans Affairs Supportive Housing, or VASH, and case management is provided through your Veterans Administration medical centers through VASH case managers. And then there's also the Family Unification Program and Foster Youth to Independence, and services are often done in conjunction with your child welfare services. And they're serving slightly different populations, but similar. So those are just some examples of all of these vouchers that are floating out in our universe for what's available there. Next slide, please. And so with funding, moving into how does this apply to folks on this call, assuming you aren't working with a public housing authority. You heard me mention there's going to be populations that overlap with who you serve. Perhaps you serve transition age youth who are going to be a good fit for some of those special vouchers, or you're working with veterans who are going to get enrolled in VASH, or just general Section 8 because they meet those definitions for extremely low income or low income. What we want to talk a little bit about is how can rapid rehousing, and I'm going to focus on that since this is an ESG-CV call, but also permanent supportive housing providers could use your service dollars and some of your financial assistance to help people with a housing voucher and to stay connected for longer terms. And what this comes down to is really, we all know getting somebody through a front door and a lease signing is just the first step of their rehousing journey. And then there's housing stability, and how do we help support folks and empower them to get connected to the right community linkages that are going to allow them to maintain their housing long-term. And that's going to be there for them in the event that when homeless service systems have to step away. Some general guidance though, rule of thumb, because it might not be that every individual on your caseload in rapid rehousing, should they receive a voucher, are going to be the right fit to blend these services together. So one thing to think about initially is when the households that you're serving, when they are receiving a voucher, you prioritize it based off of your funding source, as well as knowing that they need to be enrolled in, let's say, rapid rehousing while they're receiving their housing choice voucher. So before they lease and move into a unit, it's not something where we can like backdate after they're housed in most instances. Additionally, you've got to keep in mind that there's different eligibility sources for the housing choice vouchers, as well as for rapid rehousing. So in terms of ESG and ESG-CV, the household first has to meet your definition for homelessness, which is category 1 and or 4 for the homeless definition. And then at entry, and then at reevaluation, because we know that you don't have to worry about income at entry for rapid rehousing, but at reevaluation, so that 1 year mark, making sure their income doesn't exceed 30% area median income for annual ESG or 50% area median income for ESG-CV, as well as that they lack the resources and supports to retain housing. And this purpose is just demonstrating that they need that ongoing case management, housing stability support from you. And so you got to check the boxes on ESG that, yep, they meet that here. We can provide services while the housing authority covers the rental assistance. And then just also know in general, like duplication of benefits is that scary phrase that gets thrown around, but it's just important to keep track of ESG, or in some instances, even CoC funds. Are they providing a unique service that isn't being provided by a different public funding source? And just documenting how you're making sure that that's happening. And that's through your case notes that can be in your policies and procedures as well to make sure you're preventing it. So for instance, let's say the household meets the utility requirements for a low income household and receives some utility relief or different fees there. You're just documenting that you got them signed up there, and that's going to help to cover that portion. Or other things. I'm sure folks could throw into the chat ways that you're like, yep, we get people connected to this resource. So therefore, like, we don't need to cover that from our program because they're linked in to ongoing community supports. Next slide, please. So this is specific to ESG-CV, and I should say HUD TA created this resource to help folks figure out how to pair ESG-CV with emergency housing vouchers. But this holds true across voucher types. So this calls out specifically what services are allowable for ESG-CV when you're using it in partnership with a housing choice voucher. So for instances, you can cover housing search and placement. You can do case management and all the different details within there. And so think about like helping folks find and secure housing once they're in housing, providing additional case management and support. What that would take, assuming, let's say, mediation occurs and they need to have a conversation with the property owner, like that is something that can happen within ESG-CV for a person who's housed with a voucher. Legal services, if it's going to cause a housing instability issue, and also credit repair and counseling. All of those are things that are eligible for someone. We also need to keep in mind, though, that ESG services can only be provided for ESG annual for 30 or 24 months in a 3-year period. There's some nuances to ESG-CV, but like we got to adhere to like all of those different things that we're keeping track of. Next slide. And then you heard me mention like some financial assistance is available. I want to say first and foremost, ESG, ESG-CV, CoC, none of those funds can be used to cover the tenant portion of rent. That gets to be seen as a duplication of benefit. So put that aside. If there's a tenant portion, we'll work to support the household to look at their income to figure out how they cover that rent, but you're not using your HUD funding dollars to cover that portion. However, you can use ESG, ESG-CV to cover a variety of other things like application fees, because the voucher doesn't pay for that. You can cover the security deposit up to 2 months rent because the voucher doesn't pay for that. Last month's rent, your utility deposits or payments, moving costs. And then if you're using landlord incentives, be sure to like know that you can cover that here for housing choice vouchers, because for landlord incentives, it's neutral to the funding source that someone's being housed with. They just have to meet the eligibility requirements for ESG-CV, and then the housing that they're signing the lease for needs to meet habitability or HQS. But these are all things that are at your disposal to help get someone into housing, keep them in housing. Keep in mind, just because you heard me talk about emergency housing vouchers earlier, some communities are using service fees to cover security deposits or landlord incentives, other items. So you just would factor that out of what you're covering, because that's public benefits that are helping someone in a different way. But ultimately, you have a lot of flexibility across your program to serve households in any way but rental assistance, essentially. And you use the timeframes that are available. And this can be a really powerful resource when someone has the stability of an ongoing rental assistance paired with services. It also can allow, in terms of case managers, some of that flexibility across the board of the budget and being able to just focus on the case management. And it kind of helps with both your budget and the household budget, because there's a huge chunk that's typically eaten up by rent that they're able to then focus on how do they stabilize or build income or factor in other things. Next slide, please. So this is going to be an interesting pivot, but we're going to do it. That's all about how you pair your funding sources with EHVs. Just wanted to make sure, since perhaps not everyone is reading everything that comes out of PIH, and I'm sure a lot of you are aware, recently HUD released in the last few months their new fair market rent numbers for 2023. The great thing about this is, for the first time ever, they use private market data like Apartment List and Zillow and other places to really try to say how much has housing increased in communities across the country above and beyond. And that helped them to factor in the formula to set FMRs for the upcoming year. And the FMRs are approximately 10% higher on average, but there are some communities that saw it jump larger, like 15%, 20%. And so if you haven't checked it out for your part of California, please do so, because that also impacts for your own rental assistance with ESG and ESG-CV. But just know that vouchers are now worth a bit more in the overall community, which can sometimes help when recruiting landlords to rent, because it's going to get them closer to market rate values. It's not always a one-to-one match, but it's getting them closer. Public housing authorities get to decide when they're going to implement those. They have until January 1st of next year, which is 2 weeks away. It's not that far, but some PHAs have gone back earlier. I think they could go back into October to implement it. And then they have the flexibility to do it between 90% to 110% of the new FMRs. But they also can set payment standards that are reflected at the neighborhood level rents. So different by different zip codes, and they use just a slightly different formula. the small area fair market rents, where you know that there's going to be some parts of your community where rents are a little bit higher than others. And so that can help to make the housing choice vouchers be able to be used across the board in other communities. And if they haven't done that and they're interested, your PHA just needs to email HUD to notify them of it. It's a waiver that is available. And a lot of the PHAs, just so that you know, are able to increase their FMRs up to 120% through December of next year. That's a waiver that is available to HUD. It's typically capped at 110%, but that waiver is in place. And so they can also do that across the board for all bedroom sizes, or if there's certain ones that they want to go up. You see a lot of variation, but just want to make sure you all were aware of that when it comes to assuming you're doing any sort of housing search or location for somebody with a voucher who's in your program. There's some different flexibilities at play right now that could be used for it. Next slide, please. And then lastly, I think a lot of folks are aware of that. Here are just some other funding sources for ongoing case management or service supports that are available. There's funding at the national level that comes through the Department of Health and Human Services that then gets funneled to states. Medi-Cal funds that, a variety of things, the Mental Health Services Act, long-term care alternatives. I think a lot of folks are aware of these, but just to know how you can get people linked up to it, I'm going to throw this in the chat, where you can figure out based on your county what that looks like, who operates it, and how you can build that out. At the national level, there's been more funding that's been put into like Medicaid and Medicare to expand services that are then going to be implemented at the county level. And so it's just helpful to stay up to date with what's going on into a similar system to ours, but not the exact one, to make sure folks are getting connected to those linkages in the community for long-term resources and support. So those are just some examples. I know there was kind of a request of like, wait, how could we pair housing choice vouchers with supports of what's going on, since most vouchers don't come with support services? This is probably my shortest spotlight for you all, but that is what I have as of right now. I did put on the next slide just some different resources that'll be available for you. You could see the emergency housing vouchers funding briefs are great to look at because it outlines how you can use it for rapid rehousing and PSH for ESG and then CoC respectively. So it kind of breaks that down and gives some good parameters. But there's just some other pieces in here that may or may not be helpful as you think about how we can continue to collaborate with public housing authorities moving forward, because I think vouchers are going to be a part of our system, and how can we provide that additional support. So with that, let me throw it over to you, Kimberly.
Erica, we do have one question in the chat from Amanda Kennedy.
Yes, I see that. Okay. So Amanda said, I believe landlords are not able to deny vouchers. How are people handling this? I know some landlords that say no to HUD. So I think, Amanda, you're talking about that source of income discrimination that's been passed in California and in other places. I don't know if it's a universally across California, actually. There was a different community I was in. I know like where I live near San Diego, it's been passed there. But for folks who are working with landlords who might be saying like no Section 8, no vouchers, feel free to come off mute or throw into the chat some of the things that you've been saying to help overcome that barrier or bias.
Yeah, I've been running into landlords. As soon as I throw out Section 8 or HUD, they're just not interested. Some of them are getting kind of creative on how they're denying clients with those particular vouchers. So I'm just trying to see kind of what guidelines or what techniques other people are using. I mean, are they able to deny them, or is it just the income portion of that? I mean, I'm just kind of confused on stuff like that.
Erica, isn't it that private landlords can refuse those vouchers, but any of those that accept public funding, that they have to accept them?
That, yes, you are correct on that. I was trying to see, we did in California pass a source of income discrimination law. So it does prohibit them saying like, no, we won't accept public dollars towards that voucher. So I think sometimes that what I heard, like I was in Los Angeles, and the VA there was talking about how like they make sure the landlords they're talking to are aware of what they're saying is like discriminatory. Like, well, according to this, here's what you can and can't do. Also, I would say there's some communities that are partnering more closely with their legal aid just to provide the background, the knowledge that they need as case managers or as agencies to have those conversations, to help kind of give context to that and share those things. Because they'll also, like the other thing I've heard that's coming up is they'll say one of the creative things that comes up or in general is like 3 times the contract rent for income to be able to apply. However, what a lot of them don't realize is it's 3 times the tenant portion. That's what the requirement is for a voucher, not the overall like rental assistance. And so it's just off of that tenant portion, which if that's $30, it's 3 times $30 that they have to demonstrate they can pay. And a lot of landlords, like the smaller ones in particular, may not be aware of that. And so sharing that and like making sure that they know, like, here are other avenues that could be happening. Some groups like to like kind of be like heavy handed with like, here's what government says you can and can't do. I think you got to suss that out as you're working with landlords and property managers to find that right language. But really that source of income is an important thing to make sure that people aren't blatantly discriminating across the board. I saw some nodding, but others can feel free to come off mute and chime in with what you're doing.
Thank you.
Anyway, any other thoughts or comments that folks have? It would also be great if anyone's actually pairing services with any vouchers in their community, just to hear your lessons learned and what's going well.
Seems like we have a shy crowd today.
That's okay. Talking about like the semantics of funding sources doesn't typically get folks excited.
Yeah. Well, we won't hold you all. Thank you for joining us today. Remember that the slides and resource information will come out to everyone between today and tomorrow. If you have any questions in the meantime, or if you get any questions, after you get the information and can't find any answers in the resources provided, feel free to reach out to us and we'll, get answers back to you. Remember that a survey will pop up as you exit this session today, and we thank you for coming, and please take a minute to answer the survey questions. Have a good day.